Hello, everyone. So let's talk about one of the circulating tumor markers that is involved, which is the carcinoembryonic antigen. So, carcinoembryonic antigen, or CEA, it was first discovered in 1960s and is a mode of oncofetal antigen. It is expressed during the development and then re-expressed in malignancies. SIA, or the carcinoembryonic antigen, is the most often used tumor marker for colorectal cancer, but it is also seen in the lung, breast, and gastrointestinal malignancies. SIA, or the carcinoembryonic antigen, it can be utilized to help in colorectal cancer diagnosis, prognosis, and therapy monitoring. Although high levels of SIA, which is greater than 10 nanogram per milliliter, are usually associated with cancer, they are not specific to colorectal cancer only. Hence, SIA is not utilized for screening. In regulation and physiology of SIA, we can see that it is a large heterogeneous glycoprotein. SEA is 200 kDa, big heterogeneous glycoprotein, and it belongs to the immunoglobulin superfamily and is implicated in cell adhesion, apoptosis, and immunity. So, increased SEA, we can observe increased SEA in patients who are heavy smoker, patients who are following radiation treatment and chemotherapy, and patients also with liver damage. SEA is thought to be involved in metastasis because of its role in cell adhesion. Although SEA can be elevated non-specifically due to poor clearance or increased production, just like other serologic tumor markers. So SIA, due to extent clearance, it its level may be raised in patients with liver impairment. Depending on the assay, that the upper normal range for serum SIA is, depending on the assay, the normal range for SIA or carcinoembryonic antigen, it ranges to 3 to 5 nanogram per milliliter. So in clinical manifestation, SIA is mostly used in clinical practice as colorectal cancer marker. SIA is utilized in colon cancer for prognosis, post-surgery surveillance, and monitoring treatment response. So SIA, it can be used in conjunction with histology and TNM staging system to determine whether adjuvant therapy is required in addition for chemotherapy or treatment after surgery. Patients with usually patients with stage 2 disease and high CA levels, they should get adjuvant therapy. So in methodology, the markers for CA is the anti-CA antibodies. Although polyclonal antibodies were once utilized in CA assays, it says that monoclonal anti-CA antibodies have essentially superseded them. CA is offered on a variety of commercially available automated platforms due to due to the considerable heterogeneity of SIA, serial monitoring must be done using the same method assay. So SIA, we can see SIA that it is available on numerous commercial automated platforms. In the application of pathophysiology, the baseline of SIA readings are usually taken prior to surgical incision to ensure that the tumor burden has been successfully removed. SIA levels should be serially serially examined every 2 to 3 months after surgery and during chemotherapy to detect recurrence and determine therapeutic efficacy. The half-life of SIA is 2 to 8 days, depending on the assay or individual. Depending on the assay that is used or for the individual. SIA level should drop into the reference interval in 1 to 4 months if treatment is successful. Asymptomatic people should not be screened for colorectal cancer with SIA. While there are no particular guidelines for using SIA in other types of cancer, it may be useful for detecting recurrence of antigen positive breast, gastrointestinal and medullary thyroid carcinoma, and as well as aiding in the diagnosis of small cell lung cancer. So as you can see, Seiya is a protein that is usually or that is normally low level in the blood in adults. So we can say that if there's an increased level of Seiya, it can be it can be a marker for tumor because is usually elevated if the patient is experiencing colorectal cancers. And that would be all. Thank you.